My name is Barbara Cohn. I'm the Director of the Child Health and Development Studies at the Public Health Institute. The Child Health and Development Studies was a collaborative project with the University of California and the Kaiser Foundation Health Plan. And the plan was to enroll every single pregnancy to women who were enrolled in that health plan between 1959 and 1967 and follow those pregnancies to understand the reasons why women become ill and reasons why babies become ill, and also the factors that might keep them healthy over the life course. There were more than 15,000 families and 20,000 pregnancies enrolled in this study in that 7-year period, making this one of the largest studies of pregnancy ever done in the United States, where we can follow people forward for risk. The purpose of this study was to follow the women who were in our population forward to understand whether their events of their pregnancies could predict their risk of cardiovascular disease death in the future. Key findings of this study are that there were women who had between a 3- and 7-fold increase in risk depending on the combination of complications in pregnancy that they experienced. And so what we found is that your pregnancy history is relevant to the timing of the event of cardiovascular disease death and to your overall risk of cardiovascular disease death. And there are certain combinations that seem to be worse than others, and surprisingly, some of the primary risk factors that we already know about, like hypertension, are enhanced in relation to your risk of death if you also have a pregnancy complication like preterm birth or a small for gestational age infant, a baby who's small for days. The most important implication of this study is that any doctor who cares for a woman, regardless of her age, should get a pregnancy history as part of her screening for potential cardiovascular risk. The wonderful opportunity is that in cardiovascular medicine there are ways to prevent this disease, and there may be some women out there who need much earlier intervention than was previously thought. So if you're a woman that has experienced some of the pregnancy complications that we've discussed or found to be related to risk in our paper, what I would suggest is that she discuss this with her doctor, because he or she may decide that she is a candidate for discussing cardiovascular disease prevention at an earlier age than might normally happen. And the first doctor that most young women talk to are their obstetricians, but their obstetricians could make the decision for a referral to a physician that addresses cardiovascular health, or work with them as their primary doctor to talk about other risk factors that a woman could control that might improve her outlook and might extend her life. What distinguishes this study from other studies that have been done on this topic is its size. We have followed very many women, more than 20,000 pregnancies and more than 15,000 women. And we have looked at these complications while they were happening and recorded them very carefully. And we were able to study them in combination with each other, not just one at a time. So it's not just preeclampsia alone or gestational hypertension alone, but the combination of these events and at a particular time in pregnancy that are related to reasonably high risk of subsequent mortality, between 3- and 7-fold increase in risk. I developed the idea for this study 40 years ago, and I came to this now late second director of this study wanting to do it. And she said, "What a great idea, Barbara. Pregnancy is a signature event in the life of a woman. It's very strenuous for the heart, but our women are not yet old enough to record their cardiovascular experience. Come back later." Well, many years went by, and now I'm the director of this study. I did other research in this study population, and it's very satisfying to me to finally do the study I had always wanted to do, with the opportunity perhaps to really save a life, which is why I entered this form of science anyway.